As stated previously in the slideshow, the theory of comfort has 3 forms of comfort, and that's relief, ease, and transcendence. And then there is 4 contexts of that comfort, which could be through physical, psychospiritual, environmental, and sociocultural. So I have made a chart here to show the theory of comfort in a cancer patient and how they, in these 4 different contexts, can go from relief, ease, to transcendence. So for physical, we have pain, nausea, fatigue, anorexia, and they need relief of that. Psychospiritual, anxiety, isolation, depression, fear, all those things that they'll experience. Environmentally, there's a lot of stimulation, lights, noise, and that just decreases their comfort during their stay. Socioculturally, routine is broken. They have no routine that is what they formerly had at home. So that can actually cause some more depression, anxiety. They can't see their family and friends, especially if they were during this time, during the COVID. Finances, they're staying in the hospital. Finances are going through the roof. They may be out of work, and they may not even have insurance. So this is a huge stressor, which is obviously going to be something that decreases their comfort a lot. So we move on to the next form of comfort, which is ease. So for physical, after pain, nausea, fatigue, anorexia, you can help to find them some foods that are tolerable, because given that they may be going through chemo, it's just a lot to be able to, they don't want to eat, so you need to find something that's tolerable. They can have Zofran, maybe peppermint oil is a holistic way of easing that nausea. Rest in comfortable environments, and analgesics for pain. FaceTime with family for psychospiritual, to get rid of that isolation and depressed feeling, reassurance and full disclosure of all healthcare things that are happening for them. They need to be reassured by you. They need to know you're advocating for them and that they are fully aware of everything in their treatment plan, and that can really decrease a lot of that anxiety and fear that they may have. So they may need some help with deep breathing exercises, and some spiritual guidance is a huge one to help relieve those feelings of despair. Environmentally, we can ease this with quietness. We can cluster our care as nurses by doing things all at once, or not all at once, but clustering that care so that we're not going in and out and not having a plan for the time we're in there, and we're disrupting their sleep, which is disrupting their comfort. Try to get them in a single room instead of sharing a room with another person, and keep it at a comfortable temperature. Socioculturally, resources for financial help is a big one. It can help to really just take that load off their shoulders. Visitors are great to decrease that isolation. Unfortunately, during COVID, it's impossible. Phone calls, FaceTime, and just try to find out what routine they had prior, and that if you can keep any of that going for them, like if they wake and they like to brush their teeth right away, or just try to find any little thing that helps to keep their routine somewhat similar. And lastly, transcendence. For physical, patient is now comfortable enough to refrain from vomiting, hold down feedings. The pain's reduced, allowing them to do more of their own physical movements, and decrease those negative issues that can come along with being uncomfortable. Psychospiritual, patients understand now that their condition and their treatment plan, they feel on board, they feel in control somewhat. They can utilize those deep breathing exercises to overcome any fear, emotions that they may be going through. And spiritually, they can feel more at ease if their that spiritual side of them has been met, and that they're receiving that emotional connection with someone to be able to speak about that. And environmental transcendence is rest is achieved for the patient. So through all those interventions, we now achieve that rest for the patient. Given their diagnosis of cancer, that probably won't be enough. They're still fatigued, still ill, still not feeling great, but at least they're comfortable enough in their room, and that nurse interaction is a little decreased unless they really need it. Socioculturally, transcendence, anxiety is eased, knowing that their finances are addressed and that there is someone there advocating for them, giving them resources, and that they've had family contact, and that there is somewhat of a routine in place. So that is my little chart to just show how the theory of comfort can be played and put into real life with a cancer patient. Thank you.